and maintenance doses. Now, before we go into this topic, you need to know two things. One is volume of distribution and steady state plasma concentration. If not, please go through the videos that I've posted earlier. Now, if you look at this concentration time plot, and we know that when we repeatedly dose a drug, it starts accumulating within the body until it reaches a steady state concentration. We also know that for the drug to reach a steady state concentration, it usually takes about 4 to 5 half-lives of the drug. For most clinical scenarios, we dose the patient in such a way that when the drug reaches the steady state concentration, it falls within what is known as a therapeutic range. The therapeutic range is the range between which the drug is effective, above which you get adverse drug reaction, and below which it's not working at all. Now, for most clinical scenarios, it's fine, but for an acute setting where your patient is in ER and you want to stop a seizure from happening, or you want to have an antiarrhythmic effect, you can't wait this much time until it reaches a steady state concentration and then produces action. You want the drug to act immediately. Now, you can overcome that by giving an initial dose which is larger than the subsequent doses. So you can kind of increase the concentration like this, because the first dose is going to be of a larger amount. And this particular dose is what we call as the loading dose. We are kind of loading the patient so that they are coming to the steady state concentration, reaching the therapeutic range as fast as possible. And the subsequent doses can kind of be smaller ones, which kind of maintain the concentration. Those are called as the maintenance doses. Now, we're going to see how to calculate these doses. Now, think of the body as a beaker containing a finite amount of liquid. Now, this liquid is what is available for the drug to get dissolved in, which corresponds to the volume of distribution. Now, the volume of distribution might not be a real volume, that's why it's called the apparent volume of distribution, but it's the volume in which the drug gets dissolved in so that it reaches a particular concentration. And that concentration which is going to get, which is going to reach is kind of proportional to the dose that you give, meaning the higher you give, more will be the concentration, and of course also on the volume of distribution. Larger the volume of distribution, lower will be the concentration reached for a given dose. Now, because these three are interconnected, the dose, the concentration that will eventually get reached, and the volume of distribution, we can calculate the dose if we know the concentration that we want to achieve. So all we do is take this equation which we use to calculate the volume of distribution and slightly rearrange it to get to calculate the loading dose. So the dose is nothing but your volume of distribution multiplied by plasma concentration. So here we already know the volume of distribution. We already know what concentration we want to achieve in order to have a particular therapeutic effect. So you can multiply them and you get the dose. And we call this the loading dose because this is the dose that is going to make sure that the patient's body has enough concentration to produce action immediately. So let me write this again. Loading dose is volume of distribution times the target plasma concentration divided by F. So you might wonder what this F stands for. So F stands for bioavailability. So please go through what bioavailability is. Now, generally the loading dose is intravenous. So F will be 1. You don't have to be bothered about F, but it's not necessary that you need to load intravenously. You can also do an oral loading where the bioavailability might not be necessarily 1. It could be 0.8 or 0.9 or depending on the drug. So you can use that to calculate whichever loading dose route you want to. Now, once we have loaded the patient, all we need to do is to replenish what is getting lost per unit time, because this beaker is constantly going to keep leaking. And with what does that stand for? What we basically mean is that the drug gets slowly excreted or eliminated from the body, either through metabolism or excretion or both. So our maintenance dose is basically going to replenish what is getting lost per unit time. So all we have to do in order to calculate the maintenance dose is multiply clearance with target concentration, and you get the dose that you need to give in order to maintain the concentration within the therapeutic range. Why? Because clearance is the amount of plasma that is completely getting cleared of the liquid, and if you multiply that by concentration, you'll get the amount of drug in that liquid that is going out. So maintenance dose is basically going to put that back in, whichever goes out. So in conclusion, we have the loading dose, which is volume of distribution times the target plasma concentration, and maintenance dose, which is clearance times the target plasma concentration. So please pay attention here. The loading dose is kind of proportional to the volume of, whereas the maintenance dose is proportional to the clearance of the drug.